Ahmed, I'm the second year student. Okay, imagine for a moment that we have a law that enforces the employees to disclose the HIV hepatitis status. Let's consider the effect of discrimination brought by such law. First, we have the point of life expenses. HIV positive people need to be able to make a living and support themselves just like everyone else. And above that, we have expenses of treatment. The average cost of HIV treatment ranges from $14,000 to $20,000 a year. And untreated HIV can be fatal. So you're turning what could be a manageable chronic illness into a death sentence. You claim that employees should disclose the HIV status to help prevent the spread of HIV. But sir, according to the world we're living in, they will be discriminated and won't be able to afford treatment. Even if I assume that this will prevent the spread of infection, I'm providing prevention on the expense of treatment. There should be some sort of balance between prevention and treatment. You cannot just sacrifice a group of people for another to live. The second point is that discrimination can also limit creativity potentials. If a person with HIV works under certain limits or is unable to access certain needs he needs for his research or study, he won't be able to innovate. Thus, you're killing creative minds. Imagine this occurring to one of the thousands of scientists such as Thomas Edison, for example. If he needs certain labs to accomplish what he did, and for having HIV he couldn't do that, so we would not have ever known the lab. The third point is competition in the fieldwork. There's discrimination
Will you
based
accept the
on
point of information?
no. Third point is competition in the fieldwork. There's discrimination based on race, color, sex, national origin, age, and religion. And here we're adding discrimination on basis of health status and disability. So by such discrimination, are we allowing for a fair competition in the work field? No. A person has all the required qualifications for the job, he's the best man for the job, and he's overpowered a person less qualified just for the reason that he has an HIV and the other person has not.
Point of information?
No.
Will we leave them to them?
Yeah.
Okay, no more points of information.
And then we come to the point of health problems, loneliness, exclusion, unhappiness, and the fear of being rejected by society. Such experiences are related to discrimination that people with HIV experience by others. You may say that having HIV will affect the person's work. Well, yes, you're true. Having HIV will affect the person's work, but it will affect how you work. It doesn't affect the quality of the work. Having HIV doesn't affect their ability to do the job at all, but it does make the job being more difficult. Thus, persons can ask for what's called a reasonable adjustment. Some people have asked time to go for their medical appointments. Others have asked for flexible working hours. So, by providing proper treatment and by providing some sort of accommodation in the work field, a patient with HIV can be as effective as a normal person. We have many successful examples where a person with HIV has accomplished many achievements. For example, Freddie Mercury. He's the lead singer of Queen and one of the top-selling rock bands of all times. Freddie, he lived with knowledge of HIV for 7 years before his death, and his performance was the best till his last day. And according to members of medical professions, if Freddie had survived one more year, he would have, and beliefs in treatment of AIDS would have saved him. This also shows the importance and effectiveness of such treatments. What's confirmation?
We only have 10 seconds, so we only have time for 1 point.
Actually, he said that we think that HIV patients are unqualified. We didn't say that. We would never say that. We know quite well that HIV patients are very qualified.
So is there a question?
No.
I didn't say that HIV patients are unqualified. I said that they are qualified, but they're not. They didn't take the job. And a less qualified person took the job just for the reason that he had an HIV, and the other person who is less qualified is normal. That's not fair.
Okay, Mr. Farouk. You said that people who have HIV or hepatitis C have less chances of getting a job or research or lab.
Yes.
But do you know that in Canada, that hepatitis C is considered a disability and it's a crime to discriminate against someone because of a disability?
Okay, this comes to the point that discrimination really occurs in the world we live in. If discrimination didn't occur and if we didn't have this devastating effect on society, we would not have such laws. Above these laws, we have the ADA, the Americans with Disability Act, we have the Occupation Safety and Health Act, the Family Medical Leave Act, and many other acts and laws that protect people with disabilities and HIV and hepatitis, whatever people that have disabilities. So if we didn't have such devastating effects of discrimination on our society, we would not have had such acts and laws.
Okay, thank you.